Well, the latest data from the CDC says that 1 in 5 kids had flu-like symptoms this month, and that many of those cases were likely H1N1. So what should you do if your child gets H1N1? Dr. Michael Sevilla with Salem Community Hospital joins us this morning with answers to all of our H1N1 questions. Good morning.
Good morning.
Well, first let's talk about what should you do if you have the swine flu?
Well, the main thing is because symptoms of swine flu are very similar to other type of illnesses. You get a little bit of fever, you can get runny nose, you can get cough. Some people get vomiting and diarrhea. So obviously, treat the fever. There's fever-reducing medicines, and take a lot of fluids. Don't get dehydrated. Those are the basic things to start out with.
What if somebody has it in your household? How should you act around those people? Should you come in close contact with them? Should you live in the basement for a week till it goes away? What should you do?
Yeah. The most important things too are careful hand washing, soap and water. You can use alcohol-based products as well. And treat their symptoms. So, but yeah, I mean, you shouldn't be able to quarantine yourself unless there are other people in the house that are high risk. They have asthma, they have other chronic medical problems that put them at increased risk to get H1N1.
Now, it seems like everyone has the swine flu these days. Are doctors still testing for that, and are they diagnosing based on just their symptoms? How are they doing that?
Yeah, a lot of the emergency departments around the area now are just overwhelmed with the volume of people. A lot of them are just treating with symptoms, because sometimes testing doesn't come back very quickly, or testing sometimes comes back negative, but they're still having symptoms and they're treating anyway. So we're presuming right now most of the influenza virus right now out there is H1N1.
Now, if I know a lot of hospitals are saying if you feel like you're coming down with the flu, don't necessarily come to the emergency room unless you are like deathly ill. Is that right? Is that basically what you're saying?
Yeah, what I tell people is that the reason to seek emergency care is if you start having especially problems with breathing, and if you have chronic medical problems like asthma or other lung problems, that's the time to call your doctor or to seek emergency care.
And the vaccine, there's always some concern with vaccine. Do you recommend that people get it?
Yeah, I mean, there's a lot of information out there about the vaccine. What I tell people is, what I tell my patients is, the way that they make this vaccine is the same way that they make the regular flu vaccine. They use the same manufacturers. It's the same process. The only thing new about it is the virus that they put in it. And the main side effects, you may get a little bit of soreness at the site. There's no chance of getting the flu from the flu vaccine. So I definitely recommend it. I got my my shot this week.
Very good. And if you do get it, obviously it takes some weeks to take effect too. So don't go up to people that have swine flu and start shaking hands.
Yeah, they're saying it takes about 1 to 2 weeks before the vaccine really takes effect. But yeah, it doesn't work right away.
All right, Dr. Sevilla, always thank you very much for some helpful information. We appreciate it.
Thank you.
And for the latest on the flu, you can go to our website, WKBN.com, and click on News.